Okay, so today we're looking at a particularly harsh callus on the lateral side of the fifth metatarsal head on this patient that's come in. So this will be caused by a couple of things. It's usually pressure, and then the pressure causes the skin to thicken, and then the thickened skin, if we let it dry out, so if you're not wearing shoes or wearing open sandals or thongs or something like that around in the summertime, the skin dries out and it can crack and become very hard and painful. So basically this one's caused by pressure from the ground, pressure from the shoes that the patient wears. So basically what we go and do is just remove all this really sort of diffuse callus. There's no really hard sections that we can see in the center at the moment. So we go ahead and remove all of the hard callus that we can see. Now we do this for a couple of reasons. One, it's painful. Two, it can cause infection if it splits and bleeds. So if you're a diabetic, it's pretty important to keep on top of these sorts of calluses. And it just looks unsightly. So this patient, it's painful and looks unsightly. She's not a diabetic or any complicating factors like that. So really, we just remove it to make it a little bit more comfortable, and it looks a little bit better when we're finished. So we go ahead and remove this, sand it down with the rotary sander, and then use a moisturizer to try and encourage the skin to be nice and soft when it grows back, so it's less likely to split. If we can keep the moisture in the callus, it's less likely to split. So if you're getting corns or calluses or anything like this, just get them treated regularly and try and look for the reason why they're growing is usually pressure. So have a look at anything that can be causing pressure, like your shoes or any bony prominences in your feet that are pinching the skin, and that will give you an insight on how you can actually relieve these permanently. But that's all we do. We remove that, sand it down, suggest some emollient or some moisturizer, and then we'll probably treat this one again in about 8 to 10 weeks time.